Upper Asian blepharoplasty. Does the suture method create scar tissue? I am planning on getting the suture method done to make my current creases higher and more prominent. Eventually, when my skin sags more, I'd like to get the incision method. Does the suture method create scar tissue, and if so, where? Will this scar tissue create worse scarring when I get the incisional method in the future?
Thank you for your question. You've submitted your question without a photo. You do describe in the details of your question that you are planning to have a suture technique for your Asian eyelid procedure to bring the crease level higher and to make it more defined. And that you do intend in the future to have the incisional method to deal with any sagging skin. You express a concern about whether or not the non-incisional technique or suture method would cause scar tissue, as well as where it will be, and will that further challenge the outcome of a future surgery. Well, I can certainly share with you how I discuss exactly this question with my patients pretty much every day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery using both the non-incisional and the incisional methods has been a significant part of my practice for many years. And this type of counseling is, as I mentioned earlier, a very important discussion. And certainly this type of question arises. So we'll go first over the basic principles of what is intended when you do Asian eyelid surgery. And that is basically to create a crease or a fold where the crease is not well defined. And that is essentially creating a connection between the skin and the muscle that lifts the eyelid, and that muscle is called the levator muscle, like the word elevator, the word levator. The differentiation is that when I see a patient and I do an examination and we decide what kind of eyelid crease they want, then essentially what I look to see is there excess fat? Is there excess skin? And if there is not, then I recommend the non-incisional approach. Now, to respond to the question as to scar tissue, I think it's very important to differentiate what a physician's definition of scar tissue is and a non-physician's definition. When people think of the word scar tissue, they often perceive it as a disfigurement or as something that complicates the outcome of anything. But the reality is a certain amount of scar tissue, as defined medically, is a normal part of healing. What it basically means is that when we place the skin in a way to attach to the levator muscle, the suture will approximate or put the skin in place to create this fold. But what we expect to occur is that eventually the body forms collagen, which is essentially what we would describe as scar tissue, to help create those connections, such that if those sutures were to get loosened or require to be taken out for any reason, well, the body would still have a connection there. Now, if we want to talk about volume of scar tissue, well, I don't think you can have less volume than using a suture technique. Now, the suture technique it does vary between practitioners. I usually use what is 3 separate areas or 3 different spots on the eyelid where I would attach a stitch. Sometimes I only do 1, sometimes I only do 2. But basically, those little areas where the sutures are placed create very, very little scar tissue. And when you talk about the future, as far as when you will be ready to have incisional surgery, I would say that as a general rule, the non-incisional technique leans more towards the younger patients because they don't have a lot of excess skin. With facial aging, there is a lot of changes, including in the skin's elasticity. And in those situations, you are, of course, going to remove some skin. So, understanding that, you could imagine that there's also remodeling and changes that would make this procedure in no way significantly impacting future surgery. I've even done revision surgeries on patients who had suture technique done within a short period of time, like a couple of years. And I would go in and do revision surgery, and I would do it like an incisional technique. And I would not really find that those sutures were problematic for the procedure. There's a lot of nuance in what we do, and certainly unless there is something more complicated that transpired before any further surgery, it's not unusual for me to see a patient who, let's say, is in their mid-40s and they had non-incisional surgery done in their 20s. And when I do their surgery, and whether it's another non-incisional or more likely to be an incisional procedure, I don't really find there to be that much of an issue that they had this previous operation. Again, there is definitely variations. Some doctors use different types of stitches that can maybe create more inflammation compared to others. Some may be more aggressive about different ways to anchor the skin. So I think you can certainly discuss this with your doctor, but I think that it's not likely that it would be an issue in terms of future planned surgery, given the limited amount of trauma that occurs with non-incisional Asian eyelid surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.